all instruments are available. Estimated time for surgery is about 20 minutes.
I started out as a pediatrician, did general pediatrics, but my patients were always crying because they are children. So I go to work, I have crying patients, I come home, my kids were crying, I have no rest. I said, okay, I'm gonna do something to put these patients to sleep. So I went into anesthesia.
Okay.
So now my patients are not crying, see?
Yes.
They cry for a few minutes, then they go to sleep. Yeah. And sometimes they wake up crying, but most of the time they wake up sleepy, you know. So they're doing better than me because every morning I wake up crying. Why I left the United States, I'm one of twins. So when we were in elementary school and high school, my dad always said that one of us, that he would like to send both of us to America or Europe for our college education.
Your dad?
Yeah, my dad. Yeah, because my senior brother was already in the United States in the just after the Civil War, like in 1970. I've been doing a missionary medical excursion since the early 2000. Actually, I started going to South America in 1998, 99. I went to the Philippines, but I didn't want to come to Nigeria because I was not happy with the corruption and insecurity in Nigeria. So I didn't want to come to Nigeria, but my mom, said, how can you go to other countries to take care of people and you don't take care of your own people? So in 2001, I started coming to Nigeria.
2001?
Yeah. So I started coming to Nigeria to do medical missions, but not as big as this. I was just going to my village and surrounding villages to do primary care for the people. So I was doing that every year and sometimes twice a year. So I've been doing that since then. Then when I joined AMPA, I started coming to Nigeria with AMPA. Last year we were in Ogun State, and after doing the mission in Ogun State, I came to my village to do another one for them. Since 2001, 2002, when I started coming to Nigeria, nothing really has changed. I have not seen much of improvement, in the health care sector, and everything seems to be stationary or going backwards, unless you're looking at the high end of medical care for the rich people. You have a few hospitals in cities like Lagos or Kaduna that actually cater to the rich people, but for the general public, they cannot afford that. So the basic healthcare system that should take care of the people is failing in that aspect. In my community, there's no really hospital between my village, which is about 8 miles from here, and Umwa here. So there's no really. So people don't see doctors. There is no establishment. When people are sick, they go to the chemist to buy medication. Yeah. So unless I come, they don't see any doctor. So they're always waiting for me to come. So we don't have a system that delivers primary care to the people. And when you have chronic illness, it's not maintained. That's why you have people dying, people that shouldn't die, dying of diseases or conditions that shouldn't kill them, because there's no healthcare maintenance for these people. Well, the impact is that you just help those that you can. You cannot help everybody. There will be those that you can. There's a popular saying that if you help one person, you've helped everybody. Because that one person could be caring for 10 other people. And the impact multiplies just like that. I don't think it's for lack of knowledge that our health sector is like this. It's not just the health sector, it's on all aspects of service by the government. This present government, however, has done more in 8-9 months than the previous ones have done in 20 years. Yeah, so we are moving in the right direction. This facility here, for example, when I came here last time, I was here, nothing was really happening in this place. I came here to do an MRI, and the cost was so high that people could not afford it. So I was helping people do procedures here. And those images were being read from India, but things have improved. This facility is very good, but the technology is still behind. Yeah, this machine, for instance, is new, but it's not functional. But because most parts are missing, so it's not functional. So it was not properly installed, So the government has good motives, but they need experts, and they can reach out to diaspora for that. They can reach, because we are willing to come here at our own expense, to train and to treat as many people as possible. We are not looking to make any money, but we are looking to invest in the people that invested in our lives before we left. So as I said, it's not for lack of knowledge as to what to do, but the will to do it. Yes, they can, devote more revenue to healthcare sector. They can consult with experts as to what they need. Like if they talk to me about how to improve the operating room here, I'll tell them. If they can talk to other experts around that came for this mission as to what they need in different sectors of their specialties. Of course, we will let them know, because I want to work in an environment that is very safe for these children. Yes, that is very safe and conducive for these children. I don't have to, make cut corners and adapt. So this equipment that I'm using, for instance, if I did not bring it along, we will not have been able to do these cases, because this was not working. So I was able to adapt this thing because I've been here before. I know that I can use this kind of setup.
Oh, so you set this up yourself?
Yeah, no, not the machine,
okay.
But I set this to be in and that up. So I brought those with me.
Okay.
Yes, I brought, I basically brought everything needed, to do anesthesia for children.